there is a lag, that it's very reactive. And when the actions are taken, they're often domestically aimed. For example, travel screenings or travel bans, rather than actually dealing with the outbreak at its source. We've seen this time and time again, from Ebola in 2013, 2014, to monkeypox, to the current Ebola outbreak in Uganda. It's always going to be the case that many of the countries of the world are not going to be concerned until the outbreak impinges on their borders, even though that's short-sighted and doesn't reflect the nature of infectious disease. It's a tendency of political leaders to play to their domestic audience and to be very reactive instead of proactive. So that leaves continents like Africa needing to build up their own capacity to be able to be the first response, to be able to durably suppress an infectious disease outbreak there without external help.
There's an outbreak of Ebola in Uganda for which there is no vaccine. Is Uganda handling the outbreak, Alchon?
The outbreak of Ebola in Uganda is very concerning because it's with a strain of Ebola for which we have no countermeasures. The Ugandan government is trying to handle this with contact tracing, with personal protective equipment, and they are relying on some help from Doctors Without Borders and other aid and other NGO organizations. But I think that time will tell whether the actions that they're taking are going to be sufficient to suppress this outbreak. Uganda has dealt with Ebola outbreaks maybe a half dozen times before, so there is confidence that they can handle this outbreak. But we will see, because there are cases now, at least one case reported in the capital city, and it becomes much more difficult when you're dealing with Ebola in urban environments than when you're dealing with it in rural environments. So I think it's going to take some time to know how well the actions that they're taking are going to impact this outbreak. But I suspect it will eventually be extinguished because Ebola is not a very contagious disease. But the quicker that it gets extinguished, the safer everybody will be.
Africa's 54 countries have not received adequate international support in recent health crises, according to certain experts. Do you agree with that?
The case with infectious disease emergencies and global health crises is often that countries focus domestically and on how the crisis will impact their domestic population. And other parts of the world are an afterthought. And the danger is that when you're talking about a communicable infectious disease outbreak, there's no guarantee that it stays in one place. And the longer you allow it to fester in one area, the greater risk that you have in other parts of the world and the harder it's going to be to contain. That being said, that's not something that most political leaders or policymakers are receptive to because it's something that has a larger timescale. So yes, it is always the case that continents like Africa do get ignored for some period of time until it becomes something that becomes inignorable rather than actually dealing with the problem early on, so it never becomes a bigger problem that's harder to control. But again, that requires a level of foresight and long-range thinking that is often not present in many political leaders around the world.